Okay. Hi students, welcome to the second day of our Pediatric Clinic series. Yesterday we have read about palmar pallor as well as knuckle hyperpigmentation. A small revision of the yesterday class. Palmar pallor means a hemoglobin of less than 7 grams per deciliter, and it indicates that you need to start the patient on iron therapy. What do you mean by knuckle hyperpigmentation? Knuckle hyperpigmentation is exclusive in cases of B12 deficiency. These are all the findings that we had seen yesterday. But today, today we are going to discuss about chest indrawing and site of localization. What do you mean by retractions? Whenever any child is suffering from some pathology inside the airway, whether it is an upper airway or lower airway, invariably you have some retractions. So when you have that retractions, is it possible to find out the site of pathology? You can have retractions here, you can have retractions in the sternum, you can have intercostal retractions, or you can have a subcostal retractions. So based on these retractions, is it possible to find out the underlying site of pathology? The answer is definitely yes. You can find out the site of pathology based on the site of retractions. Let us go to the first graph. So what is this? You all know that a simple explanation of the airway. Okay, this is a sagittal cut. So this is upper airway, lower airway. What do you mean by upper airway? Upper airway means up to from your nearest to your larynx is your upper airway. So this is your upper airway. And what do you mean by lower airway? From your vocal cord to lung parenchyma is called as lower airway. So you have upper airway between nearest to vocal cord. Vocal cord or glottis is the site which separates your upper and lower respiratory tract. Okay. Whenever there is any pathology in any of these sites, it will invariably produce a sound that is called respiratory noises. Usually you don't have any respiratory noises for a silent breathing, but whenever you have some obstruction, you have some respiratory noises along with some retractions. So what are all those retractions? Let us see one by one. So upper airway means nearest to vocal cord. Lower airway means from vocal cord to lung parenchyma. Look at this. Identify the finding and tell me the site of retractions. I will play the video right now. So what is this finding? This is called as stridor. So this is called as stridor, and what retractions you have seen here? You have seen retraction in this area. This is called suprasternal retractions. I repeat, this is called as suprasternal retractions. These suprasternal retractions are suggestive of where is the pathology? The pathology for suprasternal retractions is here. What is the supraglottic region? So this is suprasternal retractions. The site of pathology is in the supraglottic region. Supraglottic region. What is the most common cause? The most common cause for the suprasternal retraction, particularly in the newborn period, is your laryngomalacia. So suprasternal retractions means the site of pathology is in the supraglottic region. The most common cause is laryngomalacia. I repeat, suprasternal retractions, you can see retractions here. The site of pathology is in the supraglottic region, and the most common example is laryngomalacia. That is the most common cause for neonatal stridor. What is this retractions? Let us see now. Look at this. Where is the retractions right now? Look at this. I repeat again, look at this. The retractions are mainly over the sternal region. This is called as sternal retractions. What is this called as? This is called as sternal retractions. What does it indicate? Sternal retractions indicates that the pathology is just behind the sternum. So what is the structure that is behind the sternum? The structure behind the sternum is your trachea, like your laryngomalacia. What do you mean by laryngomalacia? The softened larynx is called as laryngomalacia. The cartilages of larynx are soft so that they collapse during inspiration. In the same way, if your trachea gets collapsed during inspiration, that is called tracheomalacia. So what does this sternal retractions mean by? This sternal retractions is meant by there is an underlying pathology in the trachea. There is an underlying pathology in trachea, and sternal retractions are characterized by tracheomalacia. Right. Then suprasternal retraction, the most common cause is laryngomalacia. Sternal retraction, the most common cause is tracheomalacia. What is the finding with respect to laryngomalacia and tracheomalacia? In laryngomalacia, you will have only stridor, whereas in tracheomalacia, you have stridor along with cough, because trachea is the place where cough receptors are abundant. So tracheomalacia is characterized by stridor since birth. This is stridor along with significant cough. So this is tracheomalacia, which often manifests as sternal retractions. And then, what is this retractions? Let us see. What is this retraction? Where do you find these retractions are predominant? The retractions are predominant in the subcostal area. The retractions are predominant in the subcostal area, and this is called as subcostal retractions. What does it indicate? The subcostal retraction indicates that the air comes inside but it cannot goes out, as a result of which your lower part of the chest is acting too much to compress the air to let out from the lungs during expiration. So what does subcostal retraction mean? Subcostal retractions is characterized by expiratory airway obstruction. So this is characterized by expiratory airway obstruction. In which condition you will get this expiratory airway obstruction? That means air goes inside but cannot come out. Which disease? Air goes inside but cannot come out. Asthma. The most common cause is asthma. It can also occur in a condition called bronchiolitis, wheezing. The first episode wheeze is called bronchiolitis. The recurrent wheeze in a child more than 6 years is called as asthma. So subcostal retractions means expiratory airway obstruction, and it occurs as a result of, in older children we call it as asthma. In younger children it can be due to, and the first episode of wheeze due to a condition called bronchiolitis produced by viruses, most oftenly a virus called respiratory syncytial virus. And finally, look at this retraction. What is this retractions? Where these retractions are present, the retractions are predominantly over the intercostal areas. The retractions are predominantly in the intercostal areas. So this is called intercostal retractions. And these intercostal retractions, where is the pathology? Suprasternal means just behind that area, laryngomalacia. Sternal retractions means tracheomalacia. Subcostal retractions means expiratory airway obstruction, whereas your intercostal retractions means it is about lung parenchyma. It is, the pathology is in lung parenchyma. So what is the most common cause? The most common cause that affects your lung parenchyma is your pneumonia or consolidation. For a third year or a final year, this is more than enough. So pneumonia causes intercostal retraction. Any child with high grade fever comes to you with intercostal retraction. It means that the underlying pathology is in the lung parenchyma. Lung parenchyma means what? It is nothing but your alveoli. What is the commonest disease that affects your alveoli? The commonest disease that affects your alveoli for a third year or post year MBBS undergraduate is consolidation. Consolidation means community acquired pneumonia. Right, this is intercostal retractions. So what are all the things we have learnt right now? What are all the things we have learnt right now? We have learnt 4 things. So what are all the 4 things we have learnt? The first one is revision. The first thing is suprasternal retractions. Suprasternal retraction, where is the pathology? Supraglottis. Where is the pathology? Supraglottis. What is the commonest condition? Laryngomalacia. Malacia. What is the clinical picture? The clinical picture is stridor in a newborn. The clinical picture is stridor in newborn. So in entrance they will ask you, what is the most common cause for neonatal stridor? So what is the sound of stridor? This is called stridor. The most common cause for neonatal stridor is laryngomalacia. 1. Okay. Okay. Laryngomalacia. Right. So the second one. What is the second one we saw? 1 second. So a small revision. What is the small revision? We can identify the site of pathology based on retractions. The first retractions are suprasternal retractions, that is retractions predominantly over this area. The site of pathology is in the supraglottic region. The most common cause is laryngomalacia. The most common cause is laryngomalacia, and the most common presentation is neonatal stridor. The second is sternal retractions. The site of pathology is in the trachea. The most common presentation is, the most common cause is tracheomalacia. The presentation is newborn with stridor and cough. The third is subcostal retractions, indicates that there is an expiratory airway obstruction. The first episode wheeze is called bronchiolitis, whereas recurrent wheeze episodes with subcostal retraction is called as asthma in children more than 5 years. And finally, these are intercostal retractions. It indicates that the pathology is in lung parenchyma. The most common cause is consolidation. The most common cause is consolidation or community acquired pneumonia. The presentation is fever along with chest indrawing or intercostal retractions. So today we have learnt 4 things: suprasternal, sternal, subcostal and intercostal retractions. 4 site of pathology: supraglottis, trachea, expiratory airway obstruction, and finally intercostal retraction or lung parenchyma. 4 clinical condition: stridor in newborn, laryngomalacia; stridor in cough in newborn, tracheomalacia; a child with wheeze, subcostal retraction, bronchiolitis; a child with high grade fever and intercostal retraction, community acquired pneumonia. Right? Thanks for your patient listening, and we will meet in the next week on Wednesday and Thursday. I will be meeting you to teach all these simple clinical things in pediatrics. We will meet on every Wednesdays and Thursdays between 9 to 9:20. Bye bye.